I think we're about to introduce our first speaker. It's Anna Nergårdh, investigator for the Coordinated Development for Good Quality in Local Healthcare, God och nära vård. So Anna, if you're ready, please take it away.
Thank you, and thank you for the invitation to speak here today. You will soon see my pictures, I think. Yeah. Yes, I'm the head of this governmental inquiry called Coordinated Development for Good Quality Local Healthcare, an inquiry that was assigned by the government in March 2017. This is, in short, the background to the need for change, and I think that at least some of these issues are relevant for many healthcare systems. In Sweden, we do have good results in terms of medical outcome, but poorer in terms of continuity, accessibility, and patient participation. We have to meet demographic development and the expectations and needs of the population today. We have to maintain and increase quality, maintain control of healthcare costs, and address the subject of historic focus on emergency care when the needs today for a majority of patients is about chronic illness and long-term conditions. And we have to embrace the fact that a strong primary care is the best way to promote and ensure equal health. This is the time schedule of the inquiry. We have delivered 4 reports so far to the Ministry of Social Affairs, and we will deliver our final report on mental health issues in January 2021. And this is from our second report named The Reform of Primary Care, and just to show you the 7 intentions with our proposals. We need to reconstruct primary care to become the true base in the healthcare system. We need a naturally formed mission for primary care. There we at present have 21 different primary cares according to our 21 county councils. We propose a joint vision, a roadmap, and we need better ways to monitor primary care on an aggregated level. We need to move towards a more person-centered care, better access to primary care, to highlight the benefits with improved continuity, for example, to a GP, which is not common standard in Sweden today. And of course, we need to focus also on sustainable working environments for healthcare professionals. In our latest report from April this year, named A Reform for a Sustainable Healthcare System, we, in addition to our former proposals, suggest a number of improvements, such as a more structural collaboration at macro, meso, and micro level in the system, a more structural plan for each patient, what we call a patient contract, a way to visualize the agreed plan for everyone involved, the patient relative, and the healthcare workers. We need to re-investigate many of our description systems in order to promote out-of-hospital care and to cover the care carried out at the municipal level and even in the patient's home. And we're aware that many of these changes are not only changes in law and regulation, but are a great change of cultural matters. And this is how we describe our joint vision and roadmap, and actually the movement towards what we in Sweden call nära vård. And actually this is a concept very close to the international work of, among others, WHO named integrated care. In our work, we also emphasize the importance of health promotion and prevention as a key to manage the challenges in effectiveness and affordability. This is one of our main arguments for a system built on a strong primary care. We also in our reports address subjects such as interprofessional learning and teamwork, together with the importance of learning organizations and of course the importance of proper conditions for research and innovation, not least in primary care. And altogether, this picture visualizes the movement from a traditional healthcare system with emergency care and the acute hospital on a pedestal far away, hard to reach, to a healthcare system that is built on many different parts, where every part is connected and in balance and always given in a person-centered way. And this is my last slide. You can see where to find more about the inquiry and also summaries of our reports in Swedish and English. Thank you.
Thank you so much. Thank you, Anna. Our next speaker is Jenni Nordborg, Swedish National Coordinator for Life Science Strategy. So Jenni, if you're ready, please.
Yes, I am, and thank you so much for the invitation to speak at this conference. And it's great to follow on Anna's introduction, because the transformation that we are embarking on now in Sweden, it's a huge transformation, and it will really set the conditions for Sweden's future in this field. And it has a lot to do with life sciences research and innovation. But we need to break down that into our daily lives. And I do think that the title for this conference, From Data-Driven Insights to Healthcare Improvement, is really a why to why we have a national strategy for life sciences. So I'm heading a task force within the government offices that we call the Office for Life Sciences. It's a joint collaboration between the Ministry of Social Affairs, Ministry of Enterprise and Innovation, and Ministry of Research and Higher Education. And the reason for this within government cross-ministry collaboration, which is in itself somewhat a challenge, but the reason why we have this is because we are really dealing with complex issues that cannot be divided between different ministries. And that's also as a backbone and as a framework, we have the National Strategy for Life Sciences to be able to work on long-term commitments and targets to implement new ways of working. And the strategy is the reason for the strategy is also to nudge a transformation towards precision medicine, that is individualized care, really on the nära vård trajectory. Of course, prevention, to work not only downstream, but also upstream with our health care environment, and sustainability. I think that one of the most important transformations that we're working on towards for the future and for integrated care is the sustainability, both on, of course, the social and the economical aspects, but also on the ecological aspects. And that is also one reason for working on data-driven innovation in this field. So the strategy is based on 8 pillars. First of all, on collaboration and partnership. So a national strategy for life sciences is not a strategy from, for, by, and with the government. It's really with the sector to join forces on implementation, because the government can set the frameworks with new targets and also supply funding through the upcoming research and innovation bill to work with the regulations and with the government, with the governmental agencies, but not really work on the implementation and the future. That is the mandate of the healthcare regions, of the academia, of the industry, of society as a whole, and not at least with the together with the patients as a strategic driving force. The second target is really to unlock the potential of utilization of health data. That is a challenge for Sweden, but that is a challenge that we are working on in several ways. We really need to utilize the registries and the biobanks that we have to enable not only data-driven decision, but also real-time decision-making on data. And we have seen so many examples where we've been able to transform immediately now during the pandemic. There are this is really it's a crisis, but it's also an opportunity for us to implement new ways of working in a faster yet sustainable and secure way. But we need to work a lot on the policy development area and to integrate a research and innovation in delivery of care in the whole range and the whole aspect. And that is the vision that I will see for the future. That is really why we need Anna Nergårdh's investigation to set forth a future plan for healthcare in Sweden. To be able to utilize welfare technology to build strength for the future through research and innovation, and attract and build talents. Because when we are moving towards data-driven innovation and data-driven insights, we also need new competences working together in a new way. And that as a whole, those different targets really will set a new attractiveness for Sweden. It's all about building our competitiveness and building our sustainability for future health in Sweden. Implementation is made through the governmental ordinary processes, the budgetary processes, the project processes of to have principal investigations working on these different fields, and the first and foremost through collaboration with the whole sector. So thank you so much for setting this target for the conference, and I look forward to continue the day together.
Thank you so much, Jenni. So moving on, let's hear from the patient perspective. So I'd like to welcome Jakob Wenzer, patient advocate. So please, Jakob.
Thank you very much. Do you hear me?
Yep.
Oh, thank you. Yes, my name is Jakob Wenzer, and thank you for inviting me here to advocating the patient perspective. I have been doing so through the organization NSPH, which means something like the Swedish Partnership for Mental Health. And I have been active in a number of projects in the field of psychiatry where the patient is supposed to be included in the healthcare process, in the process of their own healthcare, the healthcare received. So this is kind of an end user perspective, and I have been active in three different projects of varying size. And I'm going to tell you a little bit about each one of those three. The first one was how do we include the patient perspective in the national quality registers in the field of psychiatry. And this was a project with money from SQL. I was given the possibility of designing a model and then making a pilot of the model, and I would say that it worked out quite well, but as the money ran out, the project and the model, of course, also ceased to exist. Second project was making an evaluation of the first year of the implementation of peer support in psychiatric practice. Peer support meaning hiring a person with experience of the care given as a clinic or something. As a part of the staff and as a support to patients, and bringing forth the patient perspective and representing it in the personnel group, the staff. I covered the first year, and as that year after that year, the question was, who is going to pay for this? And still no one really knows. There is not really a way to employ these peer supporters that is consistent. So some of these are not longer employed. The third project, which is ongoing, is that I'm asked to be advocating the patient or end user perspective in the design work of a new information environment in region Västra Götaland. Maybe some of you knows of this project, probably yes. I have only been a part of this for about 2 weeks. And as I have no idea of the extremely complex technological things that goes on in these discussions, I employ my own experience as a trained ethnologist instead. I have a PhD in ethnology, and I also have user experience, of course, of receiving psychiatric care. I do have a minute or two left here, yes. There seems to me to be a point of tension. Should the workflow built into these technologies follow the juridical flow or the real course of events? It also corresponds to the problem of which data to collect. Is there a possibility to collect in a very lean and simple way qualitative data covering the real experience of the people receiving the care? So one question that I would like to pose is, of course, how do we create useful data? How do we build some kind of qualitative data into the technological systems? Well, that's about what I was about to say.
Okay, thank you so much, Jakob, and thank you all. If you just stay put, I have one question for you. Even if you represent different perspectives, all of you, I would like to make some things really concrete for you. So are you ready for this question? Imagine the day that you turn 80 years old. What kind of health service and healthcare system would you like to meet at that day? Let's start with Jakob.
80 years old.
I know it's far.
Not really sure, no. On a personal level, I would say generally a more non-pathological view on neurological differences is my field of psychiatry, and a destigmatizing view on mental health issues, of course. And professionally, maybe I would like to see a consistent part of healthcare budgets set apart for ongoing efforts, making the patient a more active part in their own healthcare.
Okay.
So
okay, great. And what about Jenni? What's your vision?
Thank you for such a concrete question. When I'm 80 years old, that is exactly 30 years from now. I want to feel safe and secure. I want to feel that I'm getting the best treatment for me in the way that I want it. That is, I think it's a very good question in putting that out. And I'm really concerned that we need to have a sustainable welfare state so that not only I get that, but we all get that in Sweden. And that I'm, as Jakob said, accounted for. I'm as feel and how I want it as anybody else. But that's sort of my vision, and how that will be delivered, that is sort of up to the future, but that the target is me, and that I'm getting the availability to the best treatment that I can. That is something that I look forward to.
Great. And what about Anna? What's your view?
Well, I think Jakob and Jenni put it very well, and I think I'm very much at heart here. I think that I really want to see the system that we are trying to speak for and create well integrated, person-centered, focus on promotion, prevention, the feeling of safetyness, and always that no one should be left behind. These are real questions for me. So I hope that our investigation will contribute to that. And I hope that actually we are all patients, aren't we? Or relatives to patients. So I think that's this is a relevant question, and it's of great interest for all of us, actually. Either we are 80 years old or 50 years old or as a child.
Great. Thank you so much. Thank you so much for those responses. And participants at home, do you agree? That's food for thought. What's your vision when you turn 80?